guys, Sydney here in the AAFE Training Center. We have our beloved Abe in the chair today. We are doing some trigger point injections on him. So if you guys know Abe, he does a lot of lifting of heavy objects. He works out. Poor posture. He said it, I didn't. So yeah, just super tight. A couple trigger points back here. I did mark him up, but we'll kind of run through and I'll tell you what I'm giving him. We will, of course, clean prior to injecting. So yeah, let's take a look.
Thank you, Sydney. She has got this patient cleaned up and marked, and she is going to go ahead and use combination of botulinum toxin with lidocaine 2% and is going to break up this trigger point. So she did an examination. She knows exactly where it is. By the way, Sydney is an RN. She's one of our full-time AAFE faculty here, and she can treat trigger points with proper training, and so can you. And especially if you're a dentist, this should be part of all of your patients when it comes to TMJ and oral facial pain treatment, because this is exactly what they teach in all of the oral facial pain residencies and dental universities postgraduate. So here we go. We're going to isolate that muscle, bunch it up, really pick it up because you want to really isolate it and go in. This is a ComfortDoc syringe, 22 gauge, and we are going to find that trigger point. Now notice how this needle is moving and notice how it's having trouble getting through that trigger point. The trigger point is like a piece of scar tissue. It's a tougher piece of tissue, and we want to break that up. That is the trigger point therapy that we are trying to accomplish. Then we're going to add some lidocaine and some botulinum toxin in it to calm the muscle down. So about 15 units in this case on each muscle. We can always go back and give more if we needed to. But look how that is dragging. And look how she's using the tip of the needle like a mini scalpel to break up that trigger point. And then this will get smoother and smoother as you see as she goes ahead and breaks this up. And this is a feel. You'll be able to feel this once you get trained on this. You can feel that trigger point, how tough it is, and then feel the areas that you're going to go break it up. But look how now some of these areas are getting smoother. It just glides right in. That means she's done a good job. Now the body then will naturally heal up this scar tissue that's been broken up, and then the trigger point goes away. Sometimes they come back. Sometimes it needs retreatment, but you can see how much easier that's going in, delivers the rest of that botulinum toxin and lidocaine to the area. And that is done. It doesn't take very long. What does take a little bit of time and some training is learning how to find the trigger points, evaluating the trigger points. Many times a patient just like you or any patient, how many times have you reached back to your shoulder and found that one area that you put pressure on and that helps because it's always tight or it always hurts? That is probably a trigger point. In this case, it is sending up some pain to the jawline, to the head. That's how trigger points work. So you need to get trained on that. Now, finding that other trigger point, we found it. We now then cleaned it up a little bit more, and we are going to do the same procedure here. And again, now that you watched one, watch this one. Watch as it initially goes in. It encounters some resistance, which is the trigger point. Again, it's like a dense piece of tissue, almost like scar tissue. And then she is going to go ahead and start to break this up. So you'll be able to go ahead and really appreciate this now even more closely here. Go in, give a little bit of lidocaine. That does help the patient be a little bit more comfortable and a little bit as we go through this. And then at the end, just give the rest into that muscle. And same thing on this side. It's going to be a combination of lidocaine and botulinum toxin. You need to know how much lidocaine you're putting in so it never gets too much or too toxic, which is not going to be a problem in a big muscle like this. And she is just going side to side. Pick that muscle up just like she is doing, way off the bone and the shoulder, because you want to keep it way above the areas and other anatomy that you could influence negatively if you went ahead and just left it sitting on the patient here. So you really want to isolate it. Look how it's getting easier and easier and easier as she goes around, and that is pretty much going to be the result of this treatment. This patient is going to feel great in just a little while, many times right after the treatment, but certainly over the next couple of days as that trigger point starts to go away. Some of his headaches and jaw pain is going to go away because you push on this trigger point. That's where Refer trains. So all of you can learn to do this. It's amazing. It's been around for 50 years. Time for you to go ahead and get AAFE certification trained on oral facial pain therapy and trigger point therapy today.